All right, guys, Jamaica is one of the countries in the Caribbean hardest hit by mass migration of healthcare workers. This year isn't any different, with the University Hospital receiving over 70 resignations since the start of the year. Joining us for this discussion is the president of the Jamaican Nurses Association, Patsy Edwards Henry.
Morning. Welcome to Spy Jamaica.
Good morning, Neville. Good morning, Delia. It's my pleasure to be on.
Yeah, man, good. How are you? All is well?
All is well. Well as
yeah, fantastic.
can be.
I said at the top of the show that they leave Jamaica for greener pastures because they're getting offered in the United States, United Kingdom, Canada, and obviously for more money that they're earning in Jamaica. Is that the only reason why we are losing our nurses?
Well, nurses, you have to understand, are among 5 recruited professions in the world. Nurses ranking number 2. So worldwide, you have a global shortage of nurses. The World Health Organization says by 2030, over 9 million nurses will be needed globally. So one of the reasons why persons leave, and it doesn't make sense we try and fool ourselves. The major reason we leave is for greener pastures, but there are other reasons. The environment within which we work, the lack of resources, the lack of educational opportunities, the fact that you now have to pay for your education, the lack of promotion, and the lack of just stability in the job allows for persons to move on to what we call greener pastures.
Yeah, 2018, 504 resignations, 2019, 545, 2020, 271, and it says 2021, 108 and counting. Are we getting nurses to fill the gap of, in other words, are people going into the nursing profession, so we lose 100, do we get back 100 that year or no?
Well, persons are going into the profession, yes, because annually between the different universities, so University of Technology, University of the West Indies, Knox, Brownstone, and Stowe, we can graduate up to 400 nurses. But what happened is that a few years when IMF came in, and we were saying that we wanted to have a leaner, meaner public sector. When we were in that period of wage freeze, we were at a point where we were not employing, we were just replacing. And even for the replacement, you had to have justifications. So what has happened is that we have not been employing as much as we are losing. And we also have to understand that we're working with a cadre, and we've been saying it's over 30 years for the past 10 years. So the cadre could be close to 40 years old. So while we have expanded our services, while we have included and increased our bed capacity, we have not increased the cadre. So no, we are not employing enough to fill the gap for those who are leaving. What we are doing mainly is replacement. And one of the other challenges is that the Ministry of Health, through the Ministry of Finance, does not have a training budget in place. So, you know, they would look at what is happening in the country, do an analysis. For the next 5 years, we're going to be needing 150 nurses or 200 nurses. I am going to train and invest in these nurses. We're not doing that anymore. Since 2011, most of the nursing schools, all of the nursing schools have moved from the Ministry of Health and are now in the Ministry of Education. And nurses have to be paying for their education as much as $1.5 million to be trained. And when you have finished training, there is no guarantee of a job.
Okay.
Sometimes, you know, sometimes when I hear the associations and I hear people put forward these suggestions, these ideas, and they're very salient, I wonder to myself, why would the decision makers not agree or implement some of them? Patsy Edwards Henry, is there discussion going on? I know there was a time when to get more technical education teachers, there was a program in alignment with cost at the time. has there been discussion in terms of education of nurses and how that will happen?
We go to the table every year, Delia.
And what
We're
do
at
they
the,
say? What do they
we're
say? Why
at the
is it not being done?
negotiation table. I have to be politically correct. The
Okay.
Ministry of Health and the Ministry of Finance are the two ministries with which we bargain. The Ministry of Health is our parents' body. So when we go to the Ministry of Finance to bargain, we are told that we need to go back to the Ministry of Health. When we go to the Ministry of Health, we're referred to the Ministry of Finance. So sometimes it's a little run around the mulberry bush for us to get what we want, but we have had these discussions in more than one fora. So it has been on the table for a number of years. While we do get from the Ministry of Health and the Ministry of Finance an allocation in our negotiation to allow to sponsor nurses and children of nurses, it is not near what we need to train the number of nurses that are required to fill the gap. And what we have to understand is that while we are expanding services, it is the same number of nurses that have been here over the years that are being stretched to go into these facilities.
Yep.
And we have to understand that the wage, the salary that is also being paid is not a livable salary. So while we have nurses and we are able to graduate up to 400, a percentage of those nurses who we graduate never seek employment in Jamaica. They train here because we are sought after, and then they go and seek employment outside of Jamaica.
Madam President, sorry to jump in. I don't know if it's a fair question, but can you give me an idea of how much they would earn, say, in the United States, either in Jamaican dollars or US dollars, as opposed to what they earn in Jamaica?
The beginner nurse in Jamaica earns just about 500 US per month.
And in the States?
Just probably above that. Probably 500-600 US per month.
In Jamaica?
When you go to in Jamaica,
right?
When you go to the US, you can earn up to 4,000 and upward per month.
Hold on. Tell me that again. So they earn 500 Jamaican in Jamaica.
The beginner nurse in Jamaica
and that same nurse goes to the United States and gets 4,000 US per month?
US per month.
Ooh.
And remember, the culture in US is that you can work two jobs, you can study part-time, you can work and study. That culture does not exist here.
And sorry again to jump in. And it would be for the same job? I mean, I know they're a nurse, but it would be for doing the same thing?
Registered nurse, level 1, yes.
500 as opposed to 4,000?
Yes.
Wow. Whew. By the way, you said it was the second most needed profession in the world. I think you said that?
It's in the top 5 most recruited professions in the world.
You know what's the first one?
I am not sure in what order they come, but I know that it is security, nursing, teachers, and they are in the top 5.
Wow. Following up on what you just said a while ago, is there now time for us to begin to revisit the way we even look at nursing? I mean, as you said, in some countries, you can work within the public system, but you can also have private patients, and studying happens at different hours of the day and night. So you can work and then go to school. Is it time for us to start revisiting some of those things?
We are definitely hoping that can be a possibility, because what happens, the post-basic courses, which were with the Ministry of Health, used to sponsor, to include midwifery and critical care, are now at the universities. They are full-time programs which have to be paid for by the nurse. So you have a nurse who is earning, say, $80,000 a month. She has a family, she has a student loan of $30,000, she has a parent or so to take care of. It is totally impossible or close to impossible for that nurse to stop up working for 4 years to go to school full time while maintaining her way of life and taking care of her bills. So, what is happening is that nurses are not going to study as they usually do when they were sponsored because they just can't afford it.
Yeah.
Because remember now, they have to find the 1.2 to 1.5 million dollars to pay for the tuition, and they are only getting 2 years study leave, and um, you're not able to work while you study, which is a big challenge for our nurses.
Yeah. I
Right.
So,
realize even people who are not nurses go overseas and end up becoming nurses because of the viability.
We have to go, ma'am.
yes.
We have to go. On behalf of all of us, thank you so much for what you all have done. And I've said this 100 million times since the start of this pandemic that you guys have actually risked your lives to save ours, and we really
And we
appreciate that.
do every day. We get up, we dress up, and we show up.
Thank you very, very much. Be safe, and God bless you all.
Be safe, and remember the vaccine is coming.
Yeah. You will take it?
Yes.
All right. Patsy Edwards Henry, President of Nurses Association of Jamaica. By the way, that 500 at 150 to 1 ends up at about 75,000. That 4,000 ends up at $600,000. Huh? Whew. There's more after the break. So come.